Hey guys, what's up? My name is Moshe Levin and I'm a registered nurse in Israel. Today we're going to talk about what is a registered nurse, how to become a registered nurse, and what does a registered nurse do on a daily basis. So we'll start off. What is a registered nurse? So in Israel, we have two types of nurses. Number one is a registered nurse, like what I am. Number two is a practical nurse. A practical nurse is a nurse that studies less and also has less responsibilities. A practical nurse studies for 2 to 3 years in a nursing program. The nurse does not have an academic degree. It's a course, which at the end, they do an exam, they get a license to become a practical nurse. But some of the things that nurses do in the field, they're not allowed to do. A registered nurse studies an academic degree, a 4-year academic degree of Bachelor of Sciences in Nursing, and then does the exam to become a registered nurse and gets a license to work as a registered nurse. So what does a registered nurse do? A registered nurse on a daily basis will administer medications to patients, the medications that are needed to be given, based on what the doctor writes. At the same time, also making sure that the orders that the doctor has written are correct at the right time and at the right dose for the patient that is receiving the medication. Another thing that registered nurses do on a daily basis are assessments. There are certain assessments that are done on a weekly basis. There are certain assessments that are done on a daily basis, and some even on an hourly basis. We'll get into that deeper in another video. Another thing that registered nurses do is help patients with day-to-day activities. For example, getting dressed, changing linens, showering, going to the bathroom, changing diapers when needed, taking care of catheters, whether it's urinary catheters, vein catheters, so on and so forth, making sure that patients are comfortable taking care of themselves and helping them out with whatever they need in order to take care of themselves. Another thing that registered nurses do is help doctors with whatever the doctors need. For example, if a doctor is doing a bedside procedure, whether it be an ultrasound or a small surgery that doesn't need to be done in the operating room, the nurse will be there alongside the doctor, helping the doctor, giving them the tools that he needs, so on and so forth. How do you become a registered nurse? So in Israel, we have a 4-year program for a Bachelor of Sciences in Nursing, which is done in some colleges and some of the universities. Some people prefer to study in a college because generally it's a little bit easier to get in and the programs are a little bit easier. In universities, it's generally more respected around the world and also in Israel. So the program includes studying of anatomy, physiology, pathology, microbiology, pharmacology, chemistry, biochemistry, labs, so on and so forth. A lot of very, very basic theoretical studies in order to get an understanding of the medical field. On top of that, we also have fundamentals of nursing. This is generally done in the first year of studying, and it's a very, very long and intense course, which basically teaches the students how to perform procedures that are done by nurses to the best of their ability. This course also includes simulations that will be done by clinical teachers in the university, in simulation labs, to make sure that the students understand how it's done and also develop the proper maneuvers in order to do it properly. The course is generally based on Cozier and Arab's Fundamentals of Nursing. That's generally the textbook that is used in Israel for fundamentals of nursing. After a year and a half of theoretical studies, in most programs, nurses will start the clinical phase of their studies. They will also continue at the same time theoretical studies, but less intensely, and also start working in a hospital setting, generally in 9 to 10 different wards, depending on the program, depending on the university or college that they're studying in. And they will work under a registered nurse who is also a clinical teacher, and they will perform the maneuvers that they studied in year 1 and year 2 on patients in the hospital setting while somebody is watching and making sure that they're doing it right. It's very, very important. And generally, this stage of the study is where most students acquire most of their knowledge, practical and theoretical, in regards to working as a nurse. After 4 years, the students will sign up and do the exam, the government exam, to become a registered nurse. And once passing that exam, majority of students pass it on the first try, they will get their license to become a registered nurse. So that's our video for today. Don't forget to subscribe and hit that bell to get notifications on when we release a new video. See you soon.